When two patients are admitted with the same diagnosis, their outcomes can look completely different. One may recover in a few days, while another may require weeks of intensive care. So why should they be reimbursed the same way? That's where APR-DRG pricing comes in. APR-DRG, or All Patient Refined Diagnosis Related Groups, is a system used to classify patients based on clinical complexity, severity of illness, risk of mortality. Instead of focusing only on the diagnosis, APR-DRGs look at the full picture of the patient. This allows healthcare providers to receive reimbursement that truly reflects the level of care delivered. Here's how the process works. First, the patient is assigned a diagnosis-related group based on their primary condition. Next, additional clinical codes are added to capture the full complexity of the case. Then, two important factors are introduced: severity of illness, or SOI, risk of mortality, or ROM. Both are measured on a scale from 1 to 4, from minor to extreme. After that, a relative weight is applied. This reflects how many resources were used compared to the average case. Finally, that weight is calculated against a base rate to determine the total reimbursement. Let's go back to our two patients. Even with the same diagnosis, a patient with higher severity or greater risk of mortality will receive a higher classification. That means higher complexity leads to higher relative weight, leads to higher reimbursement. This ensures hospitals are fairly compensated for treating more complex cases. Patient classification is a multi-step process. It starts with accurate diagnosis and procedure coding using ICD-10 standard. Then claims are grouped into an APR-DRG based on clinical data like diagnoses, procedures, age, discharge status. From there, SOI and ROM are assigned based on secondary conditions. Each step must be precise because even a small error can impact the final payment. There are several risks that can lead to inaccurate reimbursement. Incomplete clinical documentation, missing secondary diagnoses, incorrect discharge status, outdated grouping logic. Any break in the chain can result in underpayment or missed revenue. That's why modern healthcare organizations rely on advanced pricing systems. These tools ensure accuracy, keep up with changing regulations, and process thousands of cases efficiently. With the right system in place, hospitals can turn clinical complexity into accurate reimbursement every time. Ready to strengthen your revenue cycle? Discover how smarter APR-DRG tools can help you stay accurate, compliant, and optimized. Request a trial today